We
Hi.
got Dr. Butler is on
Hey
the
guys.
line.
Hi.
Hi, congratulations. This is a party, y'all. Woo!
We're
Yes,
here.
we are here. They're popping in. Y'all, I have a disclaimer that I need to read. And so let me read this disclaimer before we even get started.
You.
Uh-oh, somebody's having
Uh-oh.
some technical difficulty. Uh, hold on. Hold on, y'all. Let me read the disclaimer, then I'll help them. Okay. Okay, so we need everybody to know that none of the information provided tonight is meant to serve as medical advice or instructions, and the speaker is not acting as an extension of your primary care provider. The discussion is purely informational and promotional. Your primary care provider should be consulted for official medical advice and before starting any exercise program or new medication. Also, we're going to have a Q&A afterwards. We're going to give our guest an opportunity to introduce herself, tell us about her practice, her services, and then we will have Q&A and ask questions because I know I got questions, so I'm super excited. But I just want to thank you so much, Dr. Butler. I like saying that, Dr. Butler,
I
for
like it too.
for joining us tonight. We're excited. We're very proud of you,
Thank
and
you.
we just can't wait to be serviced by you and come out and support and continue to share and like and subscribe and all that good stuff. So, without further ado, I'm going to turn this over to the lady of the hour, none other than our friend Dr. Butler.
Thank you so much, Jeanette. I can't thank you enough. And the organization for always supporting me and for supporting my family. I think you've done a great job introducing me as is. I'm no stranger to your platform. I've been here before a couple of times, but I am Dr. Mahalia Jackson-Butler. And I'm the owner of Media Elite Health and Wellness. We're located in Bedford, Texas, and we are newly opened. We had our soft launch last week, and I'm just absolutely thrilled to have the privilege and the opportunity to bring my skill set, my passion for healthcare and wellness to the community and beyond, and just kind of provide a service at a level that I would expect for myself, but that I have not seen consistently. And I think that, we can talk a little about, some of the disparities and the types of care we've received and some of the encounters we've had, but just to kind of have the opportunity to do it my way and at a higher level is just a wonderful opportunity for me, having been in this space for such a long time. So admittedly, just a little about, the practice and certainly want to open the floor for questions and kind of delve into how we might be able to serve you. We have 4 arms of services here at the clinic, and certainly can't wait for you guys to meet the team as well. So there is primary care, a little less on the chronic disease management side, but more on the minor care side. So if you want to come in with a runny nose or an upset stomach, urinary tract infection, even an STD, I'm just saying, just minor care items like you would do, or go to care now for urgent care for, we are ideal for that type of situation, and certainly for walk-ins. We do see some kind of disease management, but for the most part, it's just minor care. A big part of what we do and what I'm super excited about and super excited to talk about tonight is medical weight loss. And that is a hot topic. It's been a buzz for quite some time. And I want to talk about the MediElite experience and the MediElite difference, like how we differ in some of these fly-by-night online programs that you see. They're, touting that, they've got the weight loss drugs for you, all the popular ones for $199 a month, and this is what you get. I'm here to talk a little about what you don't get and what you might need. We also offer hormone replacement therapy, more so on the men's health side, moving into the women's health side. So not a lot to offer on that front, but I've spent quite a bit of time in men's health and just kind of focusing on kind of getting the men back who are going through, back to where they want to be, who are experiencing andropause. And then lastly, we also have a med spa on site, and we're super excited about that. I have a team of estheticians who work with me here, and very experienced across the board. And so we have a nice slate of services in that space as well. So we are offering neuromodulators. We have a laser, so skin rejuvenation, tattoo removal, that sort of thing. We have hydrofacial as well, chemical peels, the whole lot. So we are super excited to just kind of bring I think a nice spin to the healthcare space in this area. I know that we aren't the only ones offering this type of service, but we do kind of consider ourselves set apart. One thing we're really excited about this coming up in the near future is we have a meet and greet happening in the next week and a half or so. I'll post about that and share, and I'm sure Jeanette, you'll share that as well. And that's just an opportunity for you guys to kind of come out. We're a new practice in the area, so we do want to let people know we are here. So we want you to come out, kind of meet us, get to know the staff, learn a little about our services, but also have a little demo with some of our services. Many things will be free, but many things will also be deeply discounted. So we want the people to kind of come out. We want you guys to come out and again, get to know us and get to know a little about our services. And then you guys, please save the date on September 12th at 11 a.m. We're having our grand opening with the Chamber of Commerce, for Bedford, Hearst Euless Bedford, and we absolutely encourage you guys to come out and support us for that. Several vendors will be on site offering freebies, but also talking a little about the products that we do have here in clinic. So with that, please, let's get into the questions.
I have a question. Is it the therapy? Do you do hormonal therapy? And if so, could you kind of tell us what that is?
So hormone replacement therapy, my focus right now is more so on the men's side, testosterone replacement therapy, but we will be moving into bioidentical hormone replacement therapy for women as well. So estrogen, progesterone, if you meet certain criteria. So, a lot of what the ladies deal with in that space, perimenopausal or menopausal, vaginal dryness, weight gain, irritability, difficulty concentrating, just the whole lot, hot sweats, night sweats, just a whole lot of symptoms that can be effectively managed with bioidentical hormone replacement therapy or synthetic hormones. And so we will be moving again more into that space later this year, but right now our focus is on hormone replacement therapy for men.
Oh, for the men part, what exactly does that entail? Because I didn't know it was for the men. Oh.
Yeah, we can talk a little about that too. So it's, so when the men are going through the change, they have their change of life too, called andropause. So that's that male menopause. And so a lot of the time, when they kind of hit that space where they're gaining weight, their libido is low, they're dealing with erectile dysfunction, lack of energy, again, low libido, things of that nature. Testosterone has been a proven alternative to kind of getting them back to where they need to be in that space. Many of them are really suffering from low testosterone levels. And again, it's been a, absolutely effective approach to managing those symptoms in the men. So ladies, if the men are kind of experiencing some of those symptoms, you want to kind of bring them in. Let's go through the process, do a proper intake, do the blood work, see where they are, and get them, repleted.
So it is true that men go through a similar menopause.
Yes, they do. Yes,
oh,
they do.
Wow. Okay. All right. The hair. I saw your photos online.
Oh, yeah.
And about the hair. So what is that therapy called? We have a question for Debbie also. Debbie has.
Okay. Debbie Razor. Okay. So what you saw in that photo, thank you for bringing that up. I don't even think I talked about that service. So we offer microneedling with PRP. So that little solution that you saw, that was plasma that was spun down from my own blood. And that picture, in the interest of full disclosure, is my photo. And so with just 3 treatments over a period of 3 months, 1 treatment over in increments of 4 weeks, I had significant hair growth. And this has been found over and over again. Some people might consider it anecdotal, but PRP for hair restoration has been a thing for quite some time, and there's good evidence to support that it's effective.
Wow. So you actually use the plasma from your blood
Yes,
as wow. Okay.
as a serum,
As a serum.
absolutely.
Hmm.
As a topical. Now, in some instances, some of the providers do inject underneath the skin, but for me, I just apply it topically and have had really great results, as you can see in the photos.
Wow. And thanks for sharing that, because you know a lot of people don't be wanting to put that out there like that.
I don't mind at all. Look, I'm my best marketing tool. So I mean, I just thought before, we've seen it, we've done the training, we've seen the studies, we've done the research. But some of those things, for me, I thought let's just try it and see how it works for me before I, buy into it and promote it elsewhere. And I have just had really favorable results, and in several of the people that I've worked with have had very favorable results.
Awesome. Awesome. Debbie, go ahead and unmute yourself and ask your question.
Hi, everyone. Hi,
Hi,
Mahalia.
Debbie.
Oh, good to
Hi.
see you.
Good
Hi.
to know.
So I'm glad that you were talking about microneedling. I heard you mention that when you were talking about the PRP. I'm familiar with both.
Yes.
Although with the PRP, I understand that's pretty expensive treatment. Yeah. But I am a fan of skin pen. I've done 3, most recently, actually this year, because of some older scarring that I've wanted to clear up, tone, things of that nature. Right. So I really do see the results, and I know it's something that can be done monthly. Do you offer it? Will you offer it as one of your services?
Absolutely. And I
Okay.
hope you come to see me and allow me to provide the service for our estheticians. So not only are we offering the PRP, that is an option, but we also offer stem cells and other topicals. So it's just a matter of what you're interested in and what works best for you and your budget.
Mhm.
And you did mention the price. I mean, it can be quite costly, but I think that we're quite competitive. And what's beautiful about our facility is that we have creative financing options as well. For those who can't afford to get some of this extra aesthetic, services, some of the extra aesthetic services done, then there's a means for you to be able to kind of tap into, some of these other treatments.
Mhm. But you did say you do offer the skin pen currently, or you will be?
Yes, I do.
You do. Okay. Sounds
Yes.
good. That's all I have. Thank you. It's great to see
Thank
you.
you. I hope to see you, Debbie. Thank you.
Absolutely.
And I don't know what the skin pen is, so could you elaborate on what that is? Because I don't know what that
Yeah.
is.
Yeah, so I wish I could kind of show you a demo. So it's the device that is used for the purpose of completing the microneedling process. And so it's electronic, and it's got a little head on it that has multiple stainless steel needles in the tip of the head. And the purpose of that is, it vibrates at a very high speed, and it disrupts the skin, the surface of the skin, causing micro punctures in the skin. And the purpose of that, or the goal of that, is to create that disruption enough and to produce collagen and restoration of the skin. So it's a beautiful outcome. It takes a few, weeks to get the full result, but it leads to just a nice a healing process and renewed skin underneath. That's generally what we see, and even better results for some people if PRP is applied.
Hey, thank you. I'm learning all these beauty tricks and things tonight. Let's talk
That's a
about
pretty good one.
it is. Okay. Let's talk about weight loss, your weight loss
Yes.
program. So
Let's
I had already shared with you that I am doing the Wegovy shots. I've been doing it for I've lost about 40 pounds.
Excellent.
Yeah, thank you. And I've been doing it for about 8 or 9 months now. Um, and I could probably lose more. I don't be doing 100% right. I ain't gonna lie. But what do you offer? Is anything similar to that? And what other weight loss programs do you offer? Because I definitely I want to get on a regimen.
Yes.
Not just with the shots. I really need to start eating healthier. Um, right now I have I have to get a double knee replacement. So it kind of limits me as far as doing any type of exercise requiring bending of the knees. But what are your suggestions as far, I mean, what do you offer as far as what?
Oh, sure, sure. No, and thank you for being so transparent. You and I had a conversation offline, and first of all, congratulations on 40 pounds of weight loss. That's a big deal. I'm gonna answer that question by first kind of talking about a few stats, because you are not alone in the weight loss pandemic, right? This is something that is of epic proportion, and 49.9% of African American women, Black women, are considered obese or overweight, right, in the United States. And 4 in every 5 women in the United States, according to the CDC and the National Institute of Health, are considered overweight or obese. I want to talk a little also about, heart disease. The number one killer of all women, women of any race, is heart disease. And for African American women, it's heart disease and stroke. And for African American men, it's heart disease and stroke. And I feel that obesity is kind of a cornerstone to a lot of these conditions and lead to a lot of negative outcomes. And so I have been extremely passionate about medical weight loss in general, health and wellness in general for many years. I am a provider who is empathetic, because I too have, worked to balance. It's a dance, right? To balance managing my weight. And so I can kind of come to you from the perspective of having dealt with it, and who deeply understands that losing the weight is a part of the battle, right? It's an important part of the battle, and it's not always easy to do, but maintaining the weight, we struggle so much in that space because of a lack of knowledge and understanding, and that's where I come in. So here we offer all the goods, all the services, all the medications. So yes, Wegovy, if you're interested in a more formulary approach, Wegovy is semaglutide. And so we offer that formulary if you're using your insurance and that sort of thing. Ozempic, Wegovy, Mounjaro, we offer that, but we also offer the compounded version of that as well, the semaglutide, tirzepatide, the injectables, right? But we offer oral medications as well. And it might not even be a prescription medication, formulary medication. It might even be a nutraceutical or even a vitamin supplement. So we have a variety of options available to you, just depending on what your needs are and what your goals are. Not everyone is right for semaglutide or the GLP-1 class of medication. Due to, pre-existing health conditions. For example, if you have a history of medullary thyroid cancer, or even pancreatitis, if you are suffering with alcoholism, which puts you at higher risk for pancreatic involvement, you might not be a good candidate for a medication like a GLP-1 or semaglutide. So in that instance, we would just have to pivot. And so, I mentioned about the fly-by-night. I won't even say fly-by-night, that's not appropriate. But what I will say is the very prevalent online programs that are offering those medications to their patients. And it's a brief visit, and maybe there's proper investigation done prior to the patient starting the medication. I don't know if that's the case in every case, but I will tell you that some of these medications, require proper monitoring, and, proper investigation needs to be done on the part of the healthcare provider to determine if you are an appropriate candidate for that type of medication or a type of medication. For example, a medication like phentermine, which has been around for a long time, it's proven, it's effective, it's affordable. Or Qsymia, which is phentermine and topiramate. Again, some of these medications are a lot more affordable than the injectables, and that might also be a deterrent for some folks. They just absolutely cannot afford the hot topic medications, but there are alternatives that are available, again, even on the vitamins and supplement side. So I think the medication is just one part of it, because it's very effective in killing that craving noise that's in the background that tells you that you need to be eating, or when you're eating, you're thinking about what you're going to eat next. And when you're eating next, you're thinking about what's coming after that. It kind of silences that noise. And so I think, you know, the medication is hugely important, but also I think it's important to kind of get to a place where we are implementing some, you know, some self-control and some discipline and some barriers. So I think that kind of goes hand in hand, but the medications are absolutely very effective in kind of getting you to that point where you can demonstrate a little more self-control. So in addition to, you know, the medication and, you know, kind of eating the right things, knowing what to eat, there's the exercise component too. Now, what we do know is that exercise is, you know, I guess responsible for about 10 to 15% of weight loss. However, you know, that just kind of goes hand in hand with the understanding that you can't outwork a bad diet. You can work out as much as you want, but if you're going in and just, you know, finishing that workout and you're having your cake and your cookies and your whatever else it is you're eating, that is exceeding a caloric intake that is, you know, recommended for you for that day, you won't see the results that you hope to see. So it's about kind of just understanding comprehensively how all of that works, and, you know, just kind of the science behind weight loss as well.
Wow, thank you. We got a question. Katie, go ahead and unmute yourself.
Hello, doctor. How are
Hi,
you?
I'm good. How are you?
I'm good. Question for you. Many years ago, I used to do chemical peels. Now it
Oh.
seems like chemical peels are now a thing of the past. I think I reached out to somebody a couple of years ago and they said that they're only done during certain times of the year, and then they told me, and Black women should not be getting them. So I was just wondering, are they a thing of the past? And if they are, what can kind of replace it? Because when I did get them back in the day, it seemed like, you know, it just kind of, you have that glow, rejuvenated, fresh skin because that outer layer is literally peeling off. And so when it peels off, you have this fresh, beautiful skin, but it seems like that's not really done anymore.
That's a great question. Thank you for asking it and giving me an opportunity to kind of share about our services. So we do offer chemical peels here. It is not a thing of the past. We have partnered with a great cosmetic company. They got their start in Europe and they've been here active in the United States, I think since 2022. It's Noon Aesthetics. And we have a great chemical peel line for women of color. So, you know, I think that there are certain type of peels that are not ideal for us. You know, there's the higher level, the stronger level peels, but there are ones that are absolutely appropriate for women of lower or higher level Fitzpatrick. Now, I do wish my esthetician was here to talk a little more about it and speak a little more intelligently about it. That is her area of specialty, but we do in fact do, you know, offer skin peels, and they are absolutely not a thing of the past. So I encourage you, you know, to come out, meet with us, have a proper analysis done, let us know what your goals are and give us an opportunity to share, you know, kind of demonstrate some services on you.
Thank you.
Of course.
Y'all are coming up with some amazing questions because I tell you, I don't know what world I've been living in. Now I'm gonna need you to explain what is chemical peels.
Well, so what we for women of color, what we use, we go for the glycolic and the salicylic acid. There are different types of formulations that are available, you know, for that process, and it's just a process of much like what Miss Katie said, kind of, you know, disrupting that top layer of skin and kind of making way for the development or the production of that nice glowy skin underneath. So it's getting away that rough outer surface. It's not deep for glycolic or salicylic acid. It's not a deep peel, but it's enough to kind of disrupt that topical surface so that we do get that nice glow underneath.
Oh, wow.
So Jeanette, it's like when I had it, I look like, while it's peeling, I look like a snake. Or think about somebody with a sunburn. So literally your skin is peeling off. So I know back in the day they had like 3-day peel, 5-day peel, and stuff like that. But it's like you are literally, it literally peels off like the outer layer over a number of days.
Okay.
You might have had a higher level peel, like a Jessner peel. That's a deeper peel that we are not necessarily doing here at the clinic. We won't do that when we're
Okay.
doing lighter peels. Yeah, so not quite that one for our ladies of color. We do have Jessner for the lighter Fitzpatrick skin, but not quite for our people.
Okay, and so I probably shouldn't have been getting that. I know the last time I got it, I love the results, but when I
Yeah.
walked out, I looked like somebody had poured 10 buckets of grease on my face. So I was like,
No,
I will not be going anywhere looking like
I
this.
have seen the results, and it's just, and I'm not saying that it shouldn't be done. It's just that here at this clinic, that's not one that we're offering. So let me just tell you,
Right, okay.
I'm not saying that it's not something you shouldn't do, but definitely talk with your esthetician to just determine if that's the best approach. Now, I will tell you, as an alternative to that, we do have, or in conjunction to that, we do offer laser treatment too for rejuvenation. So I'd love to have you ladies out to at least have a demo, come in and just try the services and see if it works for you. But combo service and kind of bundling up is something we absolutely would love to do.
Okay, and see, here I'm so lame because I see people I don't do a lot to my skin. I mean, luckily I'm blessed. No, but I'm getting older.
You are blessed.
I'm seeing some things that I'm like, I'm getting a little dry here. But I would hear ladies say, "Oh, I'm going to get a peel," and I'm thinking, they put on a little mask and they peeled it off. So this is something totally, totally different.
Yeah, totally different, totally different. So there's a chemical reaction that's happening, a whole process, and then we get that top layer in not deep. I mean, again, we go very light here. We have the capability of offering deeper peels, but that's, again, just from a risk management perspective, it's my decision to not go with steep here. However, we do have an esthetician who can speak again more intelligently on some of the services that she, those types of peels and some of the services she provides.
Okay. We have a question in the chat. Is that recommended for older skin?
It is. Absolutely. So here we do skin rejuvenation. We're all about preserving youth. And so microneedling is really great for wrinkles, fine lines. We have the lasers for skin tightening. We've got the chemical peels for skin rejuvenation. Also, again, the microneedling, we've got dermaplaning as well for exfoliation and kind of taking away that fine layer of hair. We have a number of services available, and we certainly are not excluding women who are of a certain age.
Thank you. We got a question. Lucretia Johnson has her hand up. Go ahead and unmute, Lucretia.
Hi, Lucretia.
Hi, good evening, everybody.
Evening.
Question, how many of your services, or do any of your services work with insurance?
Aesthetics, not necessarily. And that's because unless it's medically necessary, I mean, we might be able to kind of raise an argument with your insurance company, but generally insurance does not cover aesthetics. Primary care is covered by insurance, and we do accept Blue Cross Blue Shield and United Health Group. And on the medical weight loss side, we can certainly discuss the opportunity for that as well.
Thank you.
Sure.
Thank you. Any other questions? Well, if you have questions, raise your hand or type them in the chat. I want to talk a little bit about your grand opening because you and I talked, and I know it's going to be some door prizes and some good little prizes. So talk more about that. And I know you put the date out there, but what do you want us to know, and what should we walk away with when we attend this grand opening event?
Sure. So it absolutely is our grand opening on September 12th here at the building at 11 o'clock. We will have our vendors here. So, it might be that you get a raffle for some free Botox if you haven't tried it, or Juvo. Try our cosmetic line. We're going to be offering a free chemical peel, offering a free facial. The laser will be, in use. And so if somebody wants to try laser, skin rejuvenation, we have that option. And one lucky person is going to qualify for the medical weight loss program, of course, if you, meet the criteria. And so these items will be raffled off, but a lot of the things won't even be raffled. We'll just be kind of demonstrating our services and just kind of letting you guys know who we are and what we do. We want you to know that we are trusted partners in the community and that we are knowledgeable and very extremely passionate about what we do. So our address is 2721 Central Drive here in Bedford, Texas, 76021. Again, we're doing the grand opening on September 12th at 11 o'clock. And I really hope to have you guys come out and kind of tool around, meet me, meet the team, and kind of, have an opportunity to experience some of what we're offering.
Actually, looking at my calendar, September 12th is on a Thursday.
Yes.
Okay, let me add that to my calendar. Okay, because I didn't know that we were going to be able to actually, try out some things there. So that's going to be exciting. Yeah.
Absolutely.
Okay.
What's
want
the
you to-
address again?
It's 2721 Central Drive in Bedford. And we'll post it. If you're not already following the Media Elite page, please do. We're Media Elite Health and Wellness on Facebook. Dr. B, the Wellness DNP on Instagram. Media Elite is on Instagram as well. We're on TikTok. We're on YouTube. So we are trying to be a little more active in posting. But whenever any event is coming up, we will absolutely post it on social media. So we ask you to, like, share, tell everybody about it. But, again, I want to just talk a little about, because Jeanette, you did bring up medical weight loss. And again, that's something I'm very passionate about. But, one of the things that, kind of sets us apart is we really want to get to the heart of why the weight is there. And why the process of kind of hitting your goal is stagnated. And so we do take a calculated approach, a scientific approach. I mean, it's all evidence-based, based on empiric data. And so it's a matter of kind of bringing you in and doing a proper intake, as I talked about with hormone replacement therapy, conducting a proper intake. But also looking at, those hormone levels, looking at blood, your serology test to see if there's some type of aberration happening there that might be impeding you from losing the weight. One of the things I do want to point out, and it's so important to say, when you see somebody who's obese or overweight, the assumption commonly is, okay, this person is just lazy, or this person eats too much, or whatever the case may be. But sometimes that's not the case. Sometimes we're struggling with weight loss because of a hormonal imbalance, as I mentioned before. And so what we do is we really intentionally get to the heart of what is going on, figure out, what the disruption is in homeostasis, get you balanced out. Because we can throw you on all the medicines we want, but if you are, suffering on the thyroid department, or in one of the other hormonal departments, then, it's just important and very, important. Very necessary for us to get you balanced first, so that we can move forward and have effective outcomes, effective treatment, and get the desired outcomes, should I say.
And I'm so glad you said that, because I was having a conversation with someone earlier today about that. And I think that's very good that you actually evaluate about the why of the gaining of the weight, because a lot of times people, I've seen people that I know personally that really, I don't see them hardly eating at all. I'm like, they don't hardly eat, but they gain weight. So that's really good that you take the time out to really, really evaluate, and just don't throw somebody on some pills or throw somebody on some shots. Because I even know someone, I have a cousin, she literally worked out, like she worked out, but her weight loss just doesn't come off. For as much as she worked out, you would think she would have better results with weight loss. So even with that, that proves that it's something else going on.
Absolutely. So we want to look at, the goal is to create a calorie deficit, right? That's the basic part of it. But sometimes even with that, we still struggle. And so, some folks think, well, if I don't eat, I'm just not going to eat and I'm going to lose. Well, then you create another phenomenon in the body where the body thinks, okay, I'm starving, I'm going to hold on to this. So not eating is not effective. You need to eat the right food to lose weight. So that's another part of it. And I think that's a beautiful part of our program as well. There's a huge education component, kind of teaching you about your macros, right? So that's going to be your carbs, your protein, fats. And also alcohol is considered a macro. And a lot of folks don't know that. Alcohol consumption is a weight loss propellant. I'm just going to tell you. So when you're looking at, how the body uses fuel, and you've got your carbs, your fat, and your protein. So the body's going to go for carbs first, right? Because it's just, an efficient, option for fueling the body. And then it's going to go for fat. And then it's going to go for, lastly, protein. And that's one of the things I do want to talk about. A lot of people are afraid of the semaglutides, the GLP-1s, the Wegovy's, because they talk about Ozempic base or Wegovy base. So what we see in that instance is, the client, it kind of, kills the appetite, and it slows gastric emptying and that sort of thing. So there's no desire to eat, or very little desire to eat. So we think, oh, it's great, I'm not going to eat. So if there's no fuel going in the way of carbs or fat, the only thing left is the protein. So what happens is the body has to have the fuel, and it's going to go for the protein last, but it's going to survive, right? So what you see is the muscle wasting, which is sarcopenia, normal as we age as adults, but not normal in, the 35-year-olds who are taking it. So again, you have to be very careful about, the programs that you get on, and the people who are giving you guidance and instructions. It's not a matter of just taking a shot or popping a pill. It's really about understanding how these medicines work in our bodies, and the best approach for getting to the best outcomes. And so, again, GLP-1s and those medications are highly effective, but there are some other things that you need to know, again, to look and feel how you want to feel while taking the medication.
Well, thank you definitely for that. Katie put a comment. She had a friend that eats like a bird but can't lose weight.
So that would be somebody I'd definitely be interested in seeing, to kind of take a deeper dive into what's going on with her blood work, and see if there's a discrepancy there, or an aberration. And if there's an opportunity for us to get her balanced out, that would be probably my first approach. And after, of course, conducting a proper intake history, conducting a physical, we absolutely have to look at the blood work. And then what's great about our program also is that we offer all the tools and technology. So body analytics, nutrition guides, exercise guides, weekly touch bases with the provider, the team. You have a real accountability partner. And so our programs run our 4 weeks at a time. So it's monthly subscription. And so, it takes a little time to get to your goal, but it's not that you're going to be on your own. Again, you do have a true accountability partner where we're dialed into what's happening. If you're stagnated, we want to get to the heart of why you're stagnated, and we're having real conversations and providing real education so that you know exactly what needs to happen to get to your desired outcome.
Awesome. This has been very informative. And I don't know if we have any more questions while I'm talking. You definitely can raise your hand or type in, I got a question. But this has really been very informative. I know us as ladies, and I thank you for being a valued member of Ladies in Film and Television.
Yes.
And y'all, for those y'all don't know, this is off topic. She's a filmmaker. She got a film out there. She got a thriller out there. And so this is how, for those of you that are not members of Ladies in Film, we have people on here that are not. So this is how we've connected in the film industry. So y'all, she's not only a doctor, she's a filmmaker as well. So if you ever get out there, check out her film. It's on Tubi and where else?
Oh my gosh. Peacock, Tubi, Amazon, Watch Free, Vizio, it's everywhere.
Yes.
And the title of the movie is Premonition.
Yes, Premonition, and Bill Duke.
Yes.
Is in it.
Yes.
Yes. And if you like thrillers, you're gonna love, that's it, Katie. If you like thrillers, you're gonna love this movie, y'all.
I hope so.
Watch it tonight.
Please do. Please do. Thank you for the plug.
Yes, but
Tony was amazing in that film. Yes, he was.
Oh, wasn't he? Yes. So I'm just excited about us having a connection with you and being able to help us, guide us through the things that we want to do. So tonight for me, I have learned so much in this little time, and I put it in my calendar, and I see one of my coworkers is on here, Denitra. So we probably sneak off on lunch and make it over.
Come over. I'm waiting to see you.
Yes. And come to the grand opening. So
Please.
I'm excited. Congratulations again. Do we have anyone with any other questions or congratulations or anything that you want to say to her before we let her out of our sight?
Thank you, guys.
Thank you so much for the information. It's wonderful to see us doing this for us.
Oh, thank you. Thank you. I appreciate that comment. And I'm so passionate about it. And I will say this, I want to respond to that. A lot of the research that I did do in my doctoral studies was focused on African American women, and a lot of research on obesity and overweight in our community. And this is a condition that disproportionately affects our women. So my program is geared toward anyone who needs assistance on the weight loss side, on the medical weight loss side, anyone who needs assistance, male or female of any race. However, I do know that that Black women are just kind of in a league of their own, and not in a good way, in this obesity space. And so I'm on a mission to just kind of, impart knowledge, share, be empathetic, be an empathetic provider, and kind of assist as many of our sisters as I can in making the changes that need to be made. Because again, obesity is just a cornerstone for so many other health conditions and risk factors, negative outcomes. And that's what we want to effectively mitigate. And I think by getting that weight under control, changing our diet, changing our mindset, learning a bit more about nutrition and getting healthy, we can effectively reach the goal.
I love it. Love it, love it, love it. It's good to
Yeah.
have somebody like this on our team, y'all.
And
Any
so-
other questions before we leave? I want to thank all of you. Let me go through the chat. Y'all know I'm extra. Tammy, thank you. Tammy Jackson,
Thank you.
Twyla. Thank you,
Thanks.
Debbie. Thank you, Denitra. Thank you,
Yeah.
Annie. Thank all of you ladies, Lucretia, Katie. Y'all been talking, so we already saw that you guys were on here.
Yes. Thank you.
Thank
Thank
you
you.
all so much for joining the call. We look forward to meeting, coming to see your new place and
Yes.
learning more about the services. I will definitely be there. I mean, I'm mapping it because I work downtown Fort Worth, so that is not too far for me to get on that back. Or I know how to get there quickly.
You will get here, I'm sure.
We have an hour
I want
lunch,
to
so we'll
see
be
you
okay.
with open arms. Yes, thank you.
Yes.
Katie, come for your chemical peel. Debbie, come for your microneedling. We are ready to receive you.
Awesome. 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 Well, thank you all. Thank you, ladies, for joining tonight. Thank you again, Dr. Butler, and we will be showing up and supporting and getting beautified. And I made a post on my Facebook that I'm getting my Stella on at 60. Y'all watch.
Get it.
I got 4 years to do it.
Yes, ma'am.
All right. Good night, everybody. Thank y'all again. Y'all have a good night.
Thank
night.
you. Bye.
Bye-bye.
Good night,
Bye.
everybody.